Hi, my name is Dr. Cathleen Arim, and this is my partner, Dr. Gregory Van Hale.
Hello.
We're practicing general dentists in Glendale, California. And today we're going to address the topic of missing teeth. And Dr. Van Hale, what do you feel is the most frequently asked question when it comes to missing teeth?
Well, I think a lot of patients get used to not having a tooth in a spot, and because they get used to the missing tooth, they think it's normal, but it's not. It's actually upsetting their bite, it's upsetting their face, it's upsetting the way they feel. But a lot of these patients, they get headaches, and they think they're getting a headache, whereas in some instances they're getting a headache because their teeth are not coming together anymore the way they did before they lost his tooth.
So their teeth continue to shift?
Teeth continue moving all the time because teeth they absolutely want to touch. And that's when we get our first teeth in, they're together like this. When we lose a tooth, it's like a collapsing fence. They move all the way over to when you bite on one, you can crack one right off. And they will descend down into the missing tooth spot, or even extend up into the missing tooth spot. It's a continuing problem that'll never go away until basically either you or I fix it for them.
And what I found too is that if they're missing teeth on one side, that they tend to favor the other side, so you have the patient chewing mostly on the side where they have their teeth and not where they have the missing tooth. So over time,
they get into a habit of doing that.
Right, so their facial features can change, and they could get headaches. Not everyone does, but that's another possibility. But the bite keeps shifting, so it just makes it harder to chew sometimes because the teeth are not in the right alignment.
We can fix that with either a bridge, an implant, or even a removable device for the patient to wear.
Right, so there's a solution for it. So, but we have to diagnose it and see where the patient is coming from and what they want.
Do the patients think it's going to be too expensive?
Yes, usually.
But do you think it's not? It's worth it.
It's worth it, and the longer they wait, the more expensive it gets.
How expensive do you think it could get?
Well, depending upon if they're having an implant, it could go up to $7,000-8,000 instead of $2,000,
or less even.
Yeah, it just depends on the situation.
So the sooner the interaction of the event, the sooner it's stopped, the more it's going to be less expensive for the patient.
Yes, less expensive, less work. It's
going to be less time, less work, and easier.
Exactly.
The longer they let it go, the worse it's going to get.
That's right.
Okay. Well, thank you very much. And please look at our website, and please give us a call on our phone. Thanks, Doctor.
Thank you.
Bye-bye.
Bye-bye.